6 months later, I am still healing from Bryce's birth, but I finally feel ready to talk about it. So if you haven't seen part one, I'd highly recommend checking that one out first, where I talk about how I found out I had placenta previa. But now we'll talk about the actual birth itself. So I mentioned before that bleeding with a previa is very common. It's dangerous. Don't get me wrong, it's dangerous, but it's very common. So the time between my diagnosis and leading up to around 33 and a half weeks, I felt fine. I felt okay. I had some pains here and there around my lower abdominal area, but I was okay. Despite what many would say about the third trimester, don't get me wrong, I was tired as hell all the time. And I had backaches, but that was the most of it, just the exhaustion and the back pain. But outside of that, I felt fine. At around 33 and a half weeks, I remember waking up at, I want to say it was like 3 or 4 o'clock in the morning to what felt like a gush. Now, during my entire pregnancy, I always felt like I had a lot of discharge. Sorry if that was TMI, but enough to where I would need to wear panty liners like all day, all day, every day. Again, I had discharge throughout my entire pregnancy, so it felt like a gush of discharge, which had happened before. So I got up, I went to the bathroom, went to go clean up, thinking it was going to be just a wipe up situation, and I saw blood. I'm immediately freaking out. I go to sit on the toilet and I just feel this rush. Like I passed a huge clot, is exactly what it felt like. I call my husband into the bathroom. I'm crying my eyes out because I look down in the toilet. There's blood everywhere. He, at that point, is the voice of reason, bless his soul, because I was not emotionally stable enough to know exactly what I should be doing next. So he, of course, is telling me we should go to the hospital. We need to call the doctor. I talked to the OB on call. I, of course, am explaining my situation. I have a placenta previa. Bryce, of course, we're going to call him Bryce. His name is Bryce, but we didn't have a name for him at the time. That's beside the point. Bryce is typically asleep around that time. I'm pressing around on my stomach, and thankfully, he is a reactive baby. So when you press on him, he will press back. I felt him moving, which was, gave me a sigh of relief, gave everyone a sigh of relief, but still scary because, again, I have a toilet full of blood and not entirely sure why it's there, where it's coming from, what's bleeding inside of me to see this amount in the toilet right now. So the OB tells me to go immediately to the hospital. We get to the hospital, they take my blood pressure, which of course is high, is high. Everything that's going on at that moment, yes, of course it's going to be high. They also hook me up to monitors, checking for the baby's heartbeat, making sure the heart rate is consistently okay, oxygen levels, just making sure that he's okay and then also that I'm okay. They did a vaginal exam just to look inside, see if they could see anything or if there was active bleeding, which there wasn't. There wasn't any active bleeding, which was good, but they wanted to make sure that the bleeding didn't come back. So they did admit me because they were admitting me, and they wanted to make sure that if for whatever reason I did have to go into surgery for, say, a C-section, they wanted to make sure that I had an IV. So on top of the fact that they took blood, I also had to get a stent, I think it is. So I would be prepped and ready for an IV if need be, anything were to happen. I am told that I have rolling veins. I've never been in the hospital overnight, never had a surgery. I'm blessed. This is my first experience getting an IV put in my arm. Took 4 different people who tried multiple times, mind you. I had bruises everywhere, everywhere. I am admitted, so my husband and I are staying overnight. While I was there, there was an OB, not my OB, but an OB who was at the hospital at the time doing rounds, who came in to check on me. But she had recommended at that time, since again, I was 33 and a half weeks, if for whatever reason that we had to deliver Bryce early, they were offering me a steroid shot in order to make sure that his lungs had developed enough by the time that we needed to deliver. Even if at that point we had to deliver at, say, 36 weeks, that's still early. That's still what they call late preterm. If they had to deliver him as a late preterm, it still gives him enough time between 33 and 36 weeks for his lungs to develop on their own more. So once he's delivered, he's able to breathe on his own. They had mentioned that one of the possible side effects of getting the steroid shot was ADHD when they were older. I had already been told that I had a placenta previa, already told that the likelihood of me having a natural birth like I wanted wasn't going to happen. On top of that, when you have a previa, they recommend that you deliver no later than 37 weeks to prevent you from going into labor on your own, which, again, is not all that natural. None of this is natural. I wanted to give Bryce the opportunity to stay in there as long as he wanted, stay in there as long as possible, so he could grow naturally the way he was meant to grow. And thinking about giving myself a steroid shot to accelerate his growth, it just didn't feel right. It didn't feel right to me. The decision that we made for our family was not to do it. In our heads, we were thinking, I'm not bleeding anymore. I'm going to take it easy, make sure that I'm not doing anything crazy so this bleed won't happen again. If I sit tight, we will certainly make it to 37 weeks. There's no point in giving him the shot if he's not going to need it. That was our thought process. A high-risk doctor did come to see me just to talk about what his opinion was based on everything that had happened. And he was the one who let me know, look, you're doing okay. Baby's doing perfect. You can go home. Continue to do what you've been doing, taking it easy, making sure that you're not doing any strenuous activity, the workouts, nothing going in and out of the vagina, things like that. He also mentions to me that even though you didn't have any bleeding while you were here with us at the hospital, there is a chance that it could happen again. So if it does happen again, you need to come back immediately and we'll have to keep you for longer. So urging me just to lay low, which we had every intention on doing anyway, so was a non-issue. So we went home, and at this point, it was Tuesday afternoon. I worked from home for the rest of that week. Again, I took it very easy, didn't even drive to work. I just stayed home. That Saturday, I woke up in the middle of the night around 3 or 4 o'clock in the morning again, and I felt the gush again. Immediately, I am screaming in my head, no, how is this happening again? How am I in the same position again? I haven't done anything. I'm literally laying in bed, not doing anything, and I feel this gush again. So I go to the bathroom, I check, and of course there's blood. And so I go to sit on the toilet. On my way to the toilet, I literally feel blood just trickling down my leg. I see it dripping all over the floor and on the rug. I sit down, and again, this huge rush just comes out, and it feels like I passed the largest clot of my life. So I'm crying because I can't believe we're in this situation once again, but it's muscle memory, right? So we just went through this the week before. So I call the doctor's office, talk to an OB on call. The OB on call, funny enough, ended up being the first OB that I had. I mentioned in part 1 that I had 2 OBs throughout my pregnancy, and my first OB and we didn't vibe, which was fine. She was for somebody, but she just wasn't for me. I talked to her on the phone. She's got my first, my last name, got my situation, the doctor that I went to go see instead, and she on the phone acted as if she didn't even know who I was. I get that she's got a bunch of different patients. Why would she remember little me? But she tells me exactly what the last doctor told me. So we head straight to the hospital to see how I did, how the baby was doing, to make sure everything was okay. At that point, I had accepted the fact that I was going to be there for a few nights. I had packed a bag this time. When I was packing, I wasn't sure how long I was going to be there for, so I at least had some of my things. So I stayed there for a couple of nights until night 2 that I was there heading into the third day. I felt the rush again. And I'll be honest, I don't know what, nobody knows what was causing this to happen. I'm sleeping again, like I'm laying down in the middle of the night when this happens. I am not doing anything. In the most peaceful state that I can be in, sleeping, I feel this rush coming. Once it happened, I think at this point, I'm probably just at 35 weeks, but this has been so routine for me at this point that one, I know what to do. I go to the bathroom, I check myself, the gush comes out in the toilet, I clean up. This is a little different because I'm at the hospital, so I have a nurse to call versus calling my doctor's office. But I lie in bed, and I think the part that I'm more upset about at that moment, because again, this is kind of like old news to me. These bleeds happen, but the baby's fine. I'm fine. We're both okay. I was just upset that I knew I was going to have to stay in the hospital longer. I was heading into the third day of being there, and this bleed happened, and I had to stay longer. That sucked. Like the OB comes in, she does a vaginal exam. I'm already hooked up to monitors at this point, so they've already been monitoring the baby, but they wanted to check in to see if there was any continuous bleeding, which there wasn't, thankfully, again, but they did also want to just check my cervix to see if anything was going on. And she had said that at that point, the cervix had softened, which was common at that stage of my pregnancy, but it hadn't dilated or anything, so it was just soft. But because I bled again, I had to stay, and they wanted to keep me throughout the rest of the duration of my pregnancy. That was tough to hear, that I was going to be at the hospital for that long. And they also, because this was another bleed that happened, they wanted to pull up my delivery date, my C-section date, to 36 weeks, just to make sure that I'm not going to labor in my own and the baby is going to be okay in a controlled environment, not an emergency situation. So they scheduled it for 36 instead of 37. Because of that, we had to revisit the steroid conversation because now we know that we're not going past 36 weeks. He's already going to be considered a preterm baby, a late preterm, but he will be preterm. So we ended up deciding to go ahead and do the steroid shot, knowing that regardless, they weren't going to let us go to full term. We wanted to give him, the best fighting chance that he had to thrive on his own when he was out of the womb. The steroid shot hurts like hell. If you ever got to get it, I'm sorry. But they like to have the series of shots completed at least, I think, 2 days before the baby's born, just to make sure that all of what they're giving me has gotten to him. And I believe that the 48-hour period gives it enough time for the baby to get the steroid. At this point, I asked my husband to bring my work computer so I can think about other things than being in the hospital and not being able to go home. Really, the only thing that gave me somewhat peace of mind is being hooked up and hearing Bryce's heartbeat. Now, it was two sides of the coin to it. Hearing Bryce's heartbeat was very calming, very soothing for me. It made me feel comfort. But the second that there was something weird where the rate lowered or it increased or I moved a little funny, so the monitor wasn't monitoring anything, and then there would be a bunch of beeping on the screen because it didn't hear heartbeat, so I'm freaking out. As much as it felt good to hear when his heartbeat was on the monitor, it also was petrifying if anything went wrong while he was being monitored. So that whole experience was bizarre in a place where you should feel the most secure because you're surrounded by a whole medical team that's there on call if anything were to happen is comforting, but at the same time, it's not comforting at all. People in and out of your room all the time. You don't get any sleep. It was a lot. You wonder why my blood pressure was high while I was in the hospital. Well, there you go. At this point, I am 35 weeks and I think 2 days. My OB is on call this day. My OB came to talk to me, just to check on me to see how I was doing, say hello, make her rounds, because she was working overnight that night because the following day for the weekend, she was going out of town for a funeral. So she just wanted to say hello and jokingly, but not jokingly, make sure that she told me to keep the baby in because she was going to be out. But if anything happened, there was another doctor who I'd met before that was going to cover for her again if anything happened, which we were all praying that it wouldn't. So I want to say 3 or 4 o'clock in the morning, like it always is, I had another bleed. And this is becoming a routine for me. I wake up in the middle of the night, I go to the bathroom, I pass a clot. At this time, I'm changing my pads because they've got you wearing these huge diaper pads at the hospital, but I'm changing things out and I go back to lay down. I click my button for the nurse to come in. The nurse comes in, they check me, everything, check the vitals, make sure, me and baby are okay, we're doing fine. The resident at the time, she goes to do a vaginal exam to check to see if there's any continuous bleeding, check my cervix, and there's no continuous bleeding. When she checks my cervix, she says, what do you mean, oh? She says, I don't think this looked like this yesterday. And I'm like, well, I, of course, haven't seen it. I don't know what she's looking at or what it looked like yesterday. All the resident from yesterday said was that my cervix had softened. The OB comes in. Thank God it's my OB, so I feel, comfortable with her being there. She says, you dilated. Mind you, with a previa, you are not supposed to go into labor on your own. Going into labor on your own is very dangerous because the placenta is sitting on top of the cervix. We're just going to pretend. The placenta is sitting on top of the cervix. Once you start to go into labor, your cervix starts to open up, starts to dilate. So once it's dilating, that means that the placenta that was sitting on top of it is separating. So if they separate, that can cause a lot of bleeding. Bleeding is the baby's blood supply, so it's just dangerous all around, which is why they try to avoid it by scheduling the C-section before you even go to labor. While I hadn't dilated a lot, the fact that I had dilated at all was a cause for concern. So she looks at me dead in my eye and says, you need to call your husband. I'm like, are you serious? Like, are you serious? For the bleeds that I've been having in the hospital, like this time, I hadn't even thought to call him. I hadn't even thought to text him because, again, it was 3, 4 o'clock in the morning. I'm not going to worry him about a situation that is like pretty routine these days. I feel a gush in the middle of the night. I go to the bathroom. I pass a clot. It's done. I go back to bed. I call the nurse. I'm fine. The baby's fine. There's no point in me calling him in that moment just to worry him about a situation that he can do nothing about. None of us can do anything about. So the fact that this time I actually did need to call him and he needed to come to the hospital, I'm like, what is going on? So as soon as he gets here, I want to say 25, 30 minutes later, they're shoving papers in my face, telling me I need to sign this and reading me all of the disclaimers and everything because I'm having this baby today. We so badly wanted to make it to 36 weeks. I'm saying this today about how I felt in that moment. The fact that my body wasn't able to hold it together just a little bit longer to make sure that he got to 36 or 37 or 40, I felt like I was failing Bryce at that moment. On top of the fact that I felt like my body was failing us, I've never had a surgery before. All of this is new to me being in the hospital, and it's a major surgery. I'm scared. My husband's scared. Again, they're shoving these papers in my face saying I need to sign this and that and talking to me about the risks going through this surgery. I'm just sobbing because I'm not ready. Bryce isn't ready. We're not ready as a family. He can't come today. But I started to dilate. He had to come. I remember having a conversation previously with my OB. She continuously let me know we can still make this an experience for you and your family. You will still be able to be awake for it. Your husband will be able to be there. He can cut the cord if he wants to. We can have a clear sheet so you can see us pull Bryce out. It's not what I wanted, but it put me at peace to know that there were some accommodations that could be made in order for it to be as pleasant of an experience as possible. While I was signing these papers, I heard them say that I needed to go under. And my OB said, I thought she could stay awake for this. And they said, no, because she has a complete placenta previa, she's got to go under. And it's going to be a sterile environment, so her husband can't come in. I had that bleed around 4 o'clock in the morning. My husband got there at around 4:30, 4:45. They took me out of that room at like 5 o'clock, and Bryce was born at 5:40. I am so thankful that I had a medical team around me and a support system that was able to get him out safely. But my husband and I weren't present for it. It's taken me 6 months to really come to terms with the birth experience that was stolen from us. I again am so thankful that he's here. You know, he's here, he's happy, he's healthy, he's good. But I didn't get to see it. I wasn't there for it. I was there, but I wasn't mentally there. My husband couldn't be in the room for it. He had to watch me get rolled away while he sat there in a room by himself, just hoping that everything was okay. It's almost as if I didn't feel like I gave birth because I wasn't, I didn't do anything. I laid there. I was not an active participant. I didn't see anything. I just woke up and he was there. Because I was put under, coming off of those drugs took a very long time. That day, I barely remember. Especially that morning, I barely remember. My husband had to be the one to tell me that they brought Bryce in after I had woken up, put him on my chest, and I got to see him for the first time at that moment. I don't even remember it happening. He was born at 35 weeks and a few days, so he was still early. Because we weren't able to make it to the 36, I don't know how much the steroid shot had helped by that point. He was still gurgling when they pulled him out. They were trying to get him to be good on his own, but he wasn't. So they had to put him in the NICU. He was in the NICU for 4 days. So the first moments that I do remember with my son, he was hooked up to breathing machines and IVs and in a little incubator. This is a far cry from a natural birth, but it was a successful birth. Bryce was born at 5:40 a.m. on January 17th. He is perfect. Seeing him in the NICU was hard. Not being able to, immediately put him on my chest and immediately try to breastfeed him because he wasn't able to breathe on his own. I wasn't able to start breastfeeding until he was maybe 3 days old, I want to say, 2 or 3 days old. So I'm, at this point, pumping as much as I can just to like try to get my supply going, try to get colostrum so they can put it in a bottle for him or so we can feed it to him once we visit him. But of course, it's not the same. Like I said, it's taken me 6 months to get to a point to where I'm able to talk about it and I'm not sobbing. It's emotional, but I think I have healed from it. It's taken me 6 months to heal, but I have healed. I'm able to think back at the situation and smile. about it because I see where he's at today. All of those things that took place, when they took place, as much as it pained me in the moment to have the bleeds, to be in the hospital, to stay in the hospital, to get poked and prodded, to be hooked up to monitors all night, to lose sleep, to scare my husband, scare my family each time that these situations took place. All of these things happened for a reason, and it brought us here today. Today we have a healthy, happy, thriving baby boy, a late preterm baby who's thriving. And I could not have asked for anything more. He is my light. Ah, I love that little boy. It wasn't easy getting to where I'm at today. It definitely took a lot of soul searching and talking about it. As hard as it was to talk about it, it took talking about it to get to where I'm at today. Like I said, 6 months later, I still feel the ripple of that day, but I also feel stronger, softer, but more me than I ever felt before.